Hello, good evening. My name is Dr. Saud Khan and we are trying to make a video for wire scale training for our nurses and for our EMS. Wire scale is a good tool for screening large vessel occlusion. This video is mainly for education purpose. As you know, wire scale consists of W stands for weakness, I stands for inattention on the left side, R stands for repetition of the phrase, and E stands for eyeball deviation. So number first is weakness, and the best way to examine the weakness is asking the patients to raise both hands. If the patient is weak, within the first 3 seconds the arms will drop down, and that will be weakness scale 1. Second part of the wire scale is examining the inattention on the left side, which is this. And in order to examine that, the patients who have a right MCA stroke, their head will be divided on the right side, eyes will be divided on the right side, and they will not have any attention on the left side. This is the most common reason for the right MCA big cortical stroke when we find a clinical finding. And if patient has the left-sided inattention, then patient get a score of 1. The third component comes with the repeating of a full sentence. Repeating a full sentence is usually examining the left hemisphere. We ask a patient to repeat a small sentence like, "Today it will be a very nice day." If patient is able to repeat a full sentence, it will be 0 score. But if there is some problem, and then patient will score 1. The fourth part of the wire scale is eyeball deviation. Eyeball deviation, usually when we are examining the patient and they are laying down, their eyeball will be deviated towards the right side in the right MCA stroke, and the key point is the eyeball will not cross the midline. And in case of left MCA stroke, the eyeball will be deviation towards the left side and they will not be able to cross the midline. The best thing will be at the bedside, asking the patient to say how many fingers on the right side and how many fingers on the left side. If patient is not able to cross the midline, then patient will score 1. So in summary, we have a wire scale which consists of wire W stands for weakness, score 1. I stands for inattention on the left side, score 1. R stands for repetition of a sentence, score 1, and E stands for eyeball deviation. If this scale is properly done and the scale is 2 or more than 2, it is very much suggestive of MCA trunk acute stroke. This video is mainly for education purpose and for training our nurses. Thank you for your attention.